my canisters, because I'm putting her to suction, remember what I said? So I'm gonna make sure, when you have somebody with suction, NG tube to suction, this goes to the suction thing. So I'm gonna set this to low continuous, which is in the green. So that will be as high as 80 millimeters. It doesn't turn, but I would turn it up to 80. This would be connected to what it says patient here. It's nice, it talks to me, tells me how to set this up. And then once I turn on that suction, quick and easy trip, boom, boom, it's suctioning. So I know it's working, okay? You never, never, never take and connect a tube to this, to the NG. Let me tell you, one of our travel nurses did that. Shut down the whole entire end of the unit. Because this goes directly into the wall. We had to move all of our patients from the east end to the west end because if we needed suction, we didn't have it. So, never, never. You gotta have a vacuum container. So the other thing, I've got the towel on. I've come in and provided for privacy. I've checked the ID. She's verified her name and date of birth for Hannah and I. I have 2 cups in here for her to, with the straw. Do you have a cup behind you over there, Sarah?
This whole thing?
No, a drinking cup with a straw. Man, I feel bad. What did I do with it? Yep, it's got a straw in it. You're gonna be holding that for me, Hannah, when they do it. Okay, so Mrs. P, just 1 cup is all. We're gonna have her pretend. Mrs. P, I've already introduced myself because I've been working with her. Hey, the doctor came through and told me I needed to anchor an NG tube down you. Put one down through your nostril because of the fact that you've had, you've been having issues with nausea and vomiting and stuff like that. So, have you ever had an NG tube before? No. Thank you. No. Okay. So, I've got my pen light and stuff. What I'm going to have you do, Mrs. P, I'm going to have you plug one side of your nostril and sniff through it, which you did. Now, plug the other side and sniff, which you did. Oh, okay. So, I look up in there. I don't see any deviations or anything like that. No obstructions. Mrs. P, have you ever had any issues with sinus surgery or broken nose or anything? No? So, we're good to go there. Okay, so, Mrs. P, I'm going to be bringing your head up to about setting you straight up. Can you tolerate that? Oh, good. So, close by here, I've got your Emerson basin. And we're going to put that by your hand here. So we'll bring this arm out so you can. I thought she didn't have an arm. Oh. Okay. Nice. Okay. We got several bands on you. Wrist ball here. This is your ID. And this is medication alert. Oh, okay. So we got that. So you can reach for that Emerson basin. I'm going to put some Kleenex in your hand there. So she's got those in her hand. We're going to put the towel back over because it fell down. And then, first of all, I'm going to be doing a measurement. Now, when we're doing this procedure, I'm going to be passing this tube down through your nostril. It's going to make you, when it hits the back of your throat, it's going to make you kind of cough and feel like you're going to throw up and stuff. But we're going to have you drink some water. You're going to start out with your head extended kind of back a little bit. And when you start coughing and stuff, then I'm going to have you drop your chin to your chest and start swallowing some water. and then I help make this go down faster, okay? Okay, so she's got that. It will make you a little teary-eyed and stuff, but we'll make this quick. We'll make this as fast as possible, because you're gonna feel 100% better when we get this tube in place. First of all, I'm gonna measure it. Going from the tip of her nose to her earlobe. Hold that in place. Bring it down. Xiphoid. Thank you. Check that. And we're right at 55. Okay? So I've got my piece of tape ready over here. How far am I gonna lube, guys? 4 inches. Make sure I get it good and lubed. Again, it's not a sterile technique. We're gonna have head back. I'm gonna start inserting it. Going. Okay, she's starting to cough. Head down. Gonna make sure she's drinking that water for me. Okay, so suck on that. Sip, sip, sip. Checking in there as I'm watching this, and I'm making sure that it is not coming out of her mouth. Her head's down on the chest. Okay, got to the 50 mark. Now I've got my piece of tape here. Come underneath, secure. Don't secure tape to these mannequins because it really gets them real tacky. So my tape is secured in the nostril there. I'm gonna have Hannah, can you go and let the secretary know I need a chest x-ray on Mrs. P? Okay, so she's fine. We didn't need the Emerson basin. Mrs. P, you really, really did a great job. This is a cool, wet washcloth. I'm just gonna kind of wipe her face. You know, give her a little TLC, because that was a hard procedure. Next thing I'm gonna do is check. I've got my litmus paper right here in a little container. How much air? Okay. Plug it. Insert. Pull back. How much? 5 to 10. Put it on my litmus, let it react. I'm gonna take, okay, have I had a chest x-ray, guys?
No.
Can I hook this up to suction? No. I know I'm in because I can see the vial backing up in the tubing. And it will that quick. Sometimes it really starts spewing out at you. Okay. Chest x-ray, they come up, they take her, bring her back. They tell me that now I can connect her to suction. And there will be a little tube, and this will go right on. Okay? Again, before doing this, I would have rechecked my suction gauge. Make sure it's working, and there we go. Clean up everything, get her comfortable, lower the bed, dispose of everything we didn't need. Okay, call lights right here. I'm gonna lower your head so you can kind of get a little rest. Is that okay? Are you comfortable? Okay, so that should start making you feel better in a few minutes. So I'm just gonna give you a little privacy here, let you rest, turn off your lights, table close to you, everything's ready, and call me if you need anything. I'm gonna dispose of everything that I used, clean up the room, wash my hands, and last thing, document.